Hi everyone, welcome back. In this part, we're going to explain nonspecific Stt changes, which is a debating finding in clinical electrocardiography, and has numerous differential diagnoses. Nonspecific Stt changes are very common, and may be seen in any lead of electrocardiogram. The changes may be seen in all or most of the leads, or may be present in contiguous leads, such as the inferior, anterior, or lateral leads. Nonspecific Stt changes include subtle ST segment depression or elevation, D-wave flattening, biphasic D-wave, or asymmetric shallow T-wave inversion. Remember that, in the absence of clinical history or symptoms, ST depression and D-wave abnormalities are nonspecific. Note that, although nonspecific Stt changes may be a normal variation, the term nonspecific is not synonymous to normal. Medical history, patient's chief complaint and laboratory findings, play a determining role in interpreting the underlying cause of Stt changes. This illustration demonstrates various types of nonspecific Stt changes. There are slight ST segment depressions in D1, AVL, V4 to V6. Flat T waves are present in D1, AVR, AVL, V5 and V6. Inverted T waves are observed in V2 to V4. All of these Stt changes are so-called nonspecific. Here are the differential diagnoses of nonspecific Stt changes. As you see, a wide range of cardiac and non-cardiac circumstances are associated with Stt changes. Some of them, such as anemia, fever, digoxin effect, hyperventilation, high adrenergic state and physiologic variants are benign. On the other hand, there are several underlying causes that may require specific medical care, like acute ischemia, myocarditis, cardiomyopathies, pulmonary embolia or intrinsic pulmonary disease, electrolyte and metabolic disturbances, including hypocalcemia, hypomagnesemia, hypokalemia, acidosis or alkalosis, cerebrovascular accidents such as stroke or cerebral hemorrhage. In summary, it's re-emphasized that, in absence of medical history, nonspecific Stt changes is not an indicator of a particular disease, therefore extra evaluation is required. Remember that, sometimes Stt changes may occur without any identifiable cause. Let's go through several examples. This electrocardiogram belongs to 60-year-old male, presented with decreased level of consciousness. As you see, there are shallow T-wave inversions in V1 to V4, and diffuse T-wave flattening in limb leads. Therefore, the Stt changes are nonspecific. According to the history, this patient requires immediate neurologic evaluation for cerebrovascular accidents. Next Ekg example is taken from a 76-year-old female, known case of seizure, presented with generalized seizure. As it is observed, there are T-wave inversions in inferior leads and flat T-waves in D1. So, we have nonspecific Stt changes. Other important finding in this strip is sinus tachycardia probably due to seizure. Remember that subtle ST segment depression is common in sinus tachycardia. Therefore, it is recommended to reobtain another strip after the tachycardia diminishes. This example displays a strip that belongs to a middle-aged male with transient episodes of atypical chest pain since 1 month ago. There are shallow T-wave inversions in left-sided precordial and inferior leads. So, we have nonspecific D-wave changes. This electrocardiogram can be a normal variant. Next electrocardiogram is obtained from a 60-year-old female, known case of diabetes and hypertension, presented with epigastric pain since last night. Here are subtle ST depressions in left-sided precordial and inferior leads. T-wave inversions are detectable in V4 to V6 as well. So, we have nonspecific Stt changes. Since the Stt changes are not limited to a particular anatomic location, acute ischemia is less probable. Remember that, we often expect acute ischemia to cause territorial Stt changes, but in this strip, Stt changes are present in anterolateral and inferior territories. Before going through next example, if you liked this video till now, please subscribe me and ring the bell for further videos. Our last example is this EKG that is from a 34-year-old male, with atypical chest pain and unremarkable medical history. There are diffuse T-wave flattening in all limb leads, with shallow T-wave inversion in lateral leads. So, Stt changes are nonspecific. Therefore, this EKG is not helpful in determining the cause of chest pain in this patient. Another finding in this strip is quadrigeminal PACs, which is the cause of slight irregularity. Let's review some important tips. In summary, there are different classifications for ventricular repolarization abnormalities. Some experts classify Stt changes into two main categories. 1. Nonspecific Stt changes. These changes have numerous non-infarctional causes, therefore, patient's clinical context plays a key role in establishing the underlying cause. 2. Relatively specific Stt changes that are strongly in favor of particular clinical circumstance, including acute ischemia, hyperkalemia, ventricular hypertrophy, bundle branch block and so on. Don't forget that not all T-wave inversions and SD segment depressions are due to acute ischemia. Therefore, it's not necessary to evaluate every electrocardiogram with nonspecific Stt changes for acute ischemia. Remember that territorial nonspecific Stt changes can be due to acute ischemia, but diffuse or non-territorial nonspecific Stt changes makes acute ischemia less probable. Thanks for watching this video. Wish you all the best. Have fun.